The thing I enjoy most about working in Aboriginal Health is the people I meet and the stories that I'm privileged to hear. The wonderful people and the team that I work with, the nurses and Aboriginal health workers, are just the best.
My experience in Indigenous Health has actually been so much more rewarding than I ever thought it would be. When I first started, it sounded like something interesting, a little bit daunting, but something that would broaden my horizons and help me to understand better the health of the population.
I had some apprehensions before I started at the clinic, just because I was used to only the mainstream, but I went there for 6 months and I'm still there.
I had no plan of going into Aboriginal Health whatsoever. I fell into the job. Quite frankly, it's the best job I've ever had. So I'm not planning on leaving anytime soon, and as far as I know, they're happy for me to stay on way past my registrar training.
Working here at VARS has been great. Like it's a really good team environment. You're well supported throughout. There's lots of experienced doctors around.
GP registrars need to go out to country Victoria. They need to go and see what life is out there. The achos out there are lovely and friendly, and you're going to get to see the gambit of illness that you'll see anywhere else. But you'll get more. You'll get ensconced into the community and they'll love you forever.
No. Shall we have a look? When I first decided to do a placement in Aboriginal Health, I must admit I didn't have a great understanding of Indigenous culture, particularly not of Indigenous culture in the region. I've learned a lot of things about a very proud and a very functional organisation and a very functional people who were here before anyone else was here, about a lifestyle that was not only very well structured and very complex, just like our own society today, that had art and culture and social norms and family.
We have an orientation through, when registrars do begin services at Windamara, so she'll go out on country. She'll learn a bit about the local history and knowledge as well, and also the health issues that are present in today's society in our community. They've got to get a full understanding of, I guess, the history of the services that they're coming into, the impacts that our clients have gone through, but also their grandparents as well. So they've got to get a full understanding of the transgenerational trauma that some of the clients are probably still carrying.
It's very important to know the social determinants of Aboriginal people, to why we're here. It's through loss of land and culture, and that's why, our health comes a second.
The uni student learns out of a book. So once they come to our country, learn them about our culture and our country, and that gives them a greater understanding of helping our people.
Understanding that history is sort of imperative to understanding the people and working effectively as a GP out here. There's a whole new view on life that I'd never experienced before working in Aboriginal Health, and a whole new view of health and illness itself.
As with all sort of Indigenous health services, one of the key members will be the Aboriginal health workers. By showing that they trust you as a doctor, that helps build a rapport with the patients. But they're also all skilled clinicians as well, and have a much better idea of the community and the environments around people that are, leading towards whatever the particular presentation on a day would be.
Our doctors are all being culturally trained in regards to our clients, and with us as Aboriginal health workers, we are there to advocate on their behalf, and the doctors working good with us.
Just being open to listening to the health workers is the most important way of making sure you don't step on anyone's toes or do anything inappropriate. And people are forgiving. Most of the time they'll laugh at you if you do the wrong thing, as long as you learn from your mistakes.
Until a registrar does work in a practice, like an Indigenous practice, they don't really know the full services that we are delivering.
I think the fantastic thing about working in an Indigenous healthcare team is they really do truly get the term of teamwork.
The doctor, the Aboriginal health worker, the nurses, and even the reception and the drivers, we all form part of the team.
The model of healthcare that's provided is really a model that I think would be great for anybody. We've got allied health on tap, we've got our nurses, we've got our physios, we've got occupational therapists, along with a bunch of visiting specialists who come and see patients within the service. That's a huge difference compared to most medical centres that I've worked in, where it's all well and good to be able to say you should go and see the physio, but being able to walk around to the physio's rooms and say, look, I've got Jim out here, I think he could benefit from seeing you, there's a lot more flexibility there and access is a lot easier.
The people here not only listen to you and really respect you and thank you for what you're doing, but they also help you to see where they're coming from and help you to see how sometimes something that seems medically sensible is actually really going to impair their whole life and their whole way of being. So you understand much better how to look after people, not just from a pills and potions point of view, but from a whole life point of view about how this is going to fit in with who they look after and their needs to look after other people.
Our short consults here at VARS are 30 minutes, which is a lot longer than anywhere else, and our long consults are an hour. It does give us the chance to, especially when we're seeing people for the first time, to sit down and have a yarn. And in terms of building a therapeutic relationship, I think that's a huge bonus to be able to do that. It's something that's not possible to do in a lot of other medical settings, but it's something that's really important, and you know, it's one of the reasons that I like working here.
Compared to your normal GP work, it's quite invigorating, it's very varied. You see some extreme presentations. You also get to work with a really great crew. There's a big difference between the presentations you see in a normal clinic and in the Indigenous Health clinic. For the junior registrar who's just learning, one of the scary but also very enlightening things that you see is that when people come in with an acute problem in Indigenous Health, quite often they're so much sicker and the signs are really obvious, which makes the clinical practice of medicine much more understandable. It also helps you to think on your feet and you learn how to deal with what you wouldn't normally deal with in a general practice, while still having the support of the general practice setting through your supervisor.
My supervisor is, I think, the best I could ever imagine. He has got a lot of experience in Aboriginal health. It was a remote supervision model, but I really never felt that I was being remotely supervised because of the easy availability that I had. I could literally pick the phone at any time or message him depending on the urgency of what I needed to discuss with him. He was always there.
Being a GP, I wanted to share my skills and expertise for the future medical students and registrars and GPs, so that in future they would be able to return back and work in an Aboriginal health setting.
A lot of the employment structures for registrars and doctors are different, so often staff are salaried rather than reliant on billings, which I think is lovely because it takes the pressure off having to work within Medicare to earn an income, which for registrars I think is a great way to work because you can spend longer with people.
In terms of whether I'm making a difference, particularly in regards to closing the gap for Indigenous Australians, I feel like I definitely am, and certainly everyone who works in a Indigenous health practice post does. It increases our awareness of the difficulties that Indigenous people go through, and also working with the communities. You can see how it's not just money being thrown to a problem, but the handing back of ownership and of decision making to the Indigenous people works really well.